Welcome everyone, this is Dr. Ray Strand, and for those who don't know me, I am a family physician. I've actually been in a private family practice now for over 40 years, and in the last 18 years I have really focused my medical practice on preventive and nutritional medicine. I have published and written several books, and I have been a speaker throughout the world on this subject, and I'm spreading the message of health. But I want to really share with you tonight what we're going to try to accomplish during these webinars. At this point, I'm going to be doing the Healthy Body webinars on the first and third Thursday evenings of each month, and I'm going to try to educate you on the health benefits of taking nutritional supplements. This is very key, and it's something that is dear to my heart. And I don't want you to become or think you need to become nutritional experts, but I really want to have you really learn the power and understanding of how consuming nutritional supplements can really help protect your health. And remember, taking supplements is really about health. It's not about disease. Even though I'm going to be talking about some diseases and things, I just want you to realize we are not curing anything. All we are doing is realizing the fact that your bodies are the best defense against getting any of these chronic degenerative diseases. So I'm going to be really talking to you more as a physician and giving you some insight. And tonight we're going to focus and really talk about Vinali, or grape seed extract. And so I want, at the end of this time, I'll speak and talk to you here for about 25-30 minutes, but anytime you want to, or a question comes up, you want to ask a question or a question that you want clarified, just go in the area of the question and go ahead and type it in. At the end of the webinar, I'll go ahead and try to answer as many of those as I possibly can. So what we're going to do is spend about 25-30 minutes in lecture mode, and then I'm going to go ahead and open it up for question and answers. So I really hope that you enjoy tonight and that you start to understand what we are trying to accomplish at RX. But I want you to first really understand why grapeseed extract is such a wonderful nutrient, why it's so important, and why RX actually even put it in their optimals. We look at grapeseed extract because it has very potent antioxidant quality. It's in the class of a polyphenol. Some people call them bioflavonoids. Really, it's Proanthocyanidins is the key nutrient. But it, to me, is one of the most potent antioxidants known to man. There are studies that show it's 50 times more potent than vitamin E or vitamin C. And this is critical because if you've heard me speak before, my whole goal in practicing nutritional medicine is to bring oxidative stress back under control. That's the dark side of oxygen. And what I mean by that is that it's all about balance. You want to have enough antioxidants on board to handle the number of free radicals you are producing. If you have that, then you don't have any oxidative stress. And we know that oxidative stress, or that dark side of oxygen, is actually the root cause of over 100 chronic degenerative diseases. Those diseases you and I would love to avoid, like heart disease or cancer, diabetes, Alzheimer's, dementia, Parkinson's disease, macular degeneration, lupus, MS, and the list just goes on and on. But what is so unique about grapeseed extract is that it's also a natural anti-allergen. In other words, in my practice, when I have patients that come in with asthma or hay fever or chronic skin problems like urticaria or hives, I find that grapeseed extract is a wonderful supplement to recommend to those people. Now, it is also a natural anti-inflammatory, and I'll explain this more later as we progress through this webinar. But it actually has a tremendous ability to cut out inflammation, so you see it being very helpful in any any disease process where there's inflammation, and it does it naturally. But another unique aspect of grapeseed extract is that it actually incorporates itself into the elastic fibers of your smallest arteries, your blood vessels, and strengthens those arteries. And I'll explain why that's so key. It's just a characteristic of grapeseed extract. But what is really unique and really ideal for grapeseed extract is that it penetrates all tissues, especially the brain. So it gets into the fluid around the brain, nerves, and eyes. And this can be very, very important in a lot of different clinical situations. So let's first talk about cardiovascular disease. Now, I have always shared in my lectures that heart disease is the #1 killer of people worldwide. But heart disease is not a disease of too much cholesterol in your arteries or bloodstream. Heart disease is a low-grade inflammation. It's an inflammatory disease. So when I approach someone in my practice who either has a strong family history of heart disease, maybe they've had angioplasty, bypass surgery, or known heart disease, or maybe they've had a stroke, I always try to eliminate all causes of inflammation. That's my approach. But one of the keys is that we know that LDL cholesterol, which we all call bad cholesterol, really isn't bad unless it becomes modified or oxidized by these excessive free radicals. Well, grapeseed extract is well known to protect that LDL cholesterol from becoming oxidized. So your LDL cholesterol never becomes bad. The other thing it does in cardiovascular disease is it increases the production of a very important nutrient called nitric oxide. Now, nitric oxide is produced and is especially important in your arteries, and when you have enough nitric oxide, it helps dilate your arteries or increases blood flow. Another key thing that grapeseed extract does, it actually decreases the platelet stickiness. In other words, the final event in a heart attack is a blood clot. And we know that we can take aspirin to help this, stickiness, but grapeseed extract is a natural way to do it. So when you take grapeseed extract, you not only protect your LDL, but you allow increased production of nitric oxide, and you actually dilate your arteries, which increases blood supply to not only your heart, but to all parts of the body. The other thing is that the grapeseed has been shown is that it lowers blood pressure. In fact, some studies show that it can lower the diastolic, the low portion of the blood pressure, or systolic, by 8 to 10 points, just taking grapeseed extract. And we know that just like any pump or pipe system, if your cardiovascular system is under greater pressure, it's just not going to last as long. Now, here's a key thing that I'm really excited about. It actually improves insulin sensitivity. Why is that important? Well, insulin resistance, or that lack of sensitivity to insulin, is the root cause of the metabolic syndrome or prediabetes. Well, the metabolic syndrome has a constellation of problems where you gain this unusual amount of weight around your middle. Your blood pressure goes up, your triglycerides, that other fat in the blood, goes up, your good HDL cholesterol goes down, and eventually your blood sugars go up. All of those significantly increase your risk of having a heart attack or a stroke. In fact, diabetic patients, whether they're type 1 or type 2 diabetics, 80% of them will die prematurely from a cardiovascular event. So in treating my patients who have diabetes, it's very, very critical that we improve insulin sensitivity. This is just a very important aspect. Now, here is something a lot of people don't realize, but there are many clinical studies out there that show that grapeseed extract also protects against cancer. How does it do that? Well, first of all, remember I told you that grapeseed extract is one of the most potent antioxidants that we know today. Well, antioxidants have that ability to neutralize these free radicals and actually protect the DNA nucleus of the cell. So there's no damage in the DNA to begin with. But also, it has been shown that it can actually optimize your body's natural immune system and natural repair system. So even if there is damage, the body has ability to heal itself. And so by supplying these nutrients at optimal levels, it's key in actually helping to prevent cancer. Now, studies show that grapeseed extract has suppressed breast cancer growth by 72%. It actually enhances cancer cell death. Now, that is a process we call apoptosis. You see, normally the cell has this ability to destroy itself if it starts growing abnormally. It actually has this self-destruct mechanism, but cancers want to have a life of its own. So everybody is looking for what would set off this natural cell death again. So cancer suppresses what we call this natural cell death or apoptosis, but grapeseed extract can actually turn that back on. And so it increases it by 33% in some studies. And for the men out there, you decrease your rate of prostate cancers by 41%. Now, there are many ways. I've told you that it can suppress breast cancer growth, it can enhance apoptosis, but also what it can do is it can block the blood supply to the tumors. In other words, tumors that grow, which cancers are, they need blood supply. And so the VEGF, and this is a growth factor, and the angio-1, which is a growth factor for blood vessels, is actually suppressed and decreased in those individuals who consume grapeseed extract. So these are just some of the mechanisms, but what we know is that physicians diagnose cancer at the very last stages. The best chemoprevention we can do is nutritional supplementation. Now, I'm going to be speaking again the first Thursday in March, and I'm going to actually talk about CoQ10 and show you how you combine these two together. They're wonderful at helping suppress cancer growth and helping you fight off cancers. So let's look at another key aspect that I mentioned about grapeseed extract. The key aspect here is that the grapeseed extract is a very small molecule, and it has the ability to cross what we call the blood-brain barrier. Now let me explain that. There's a barrier to nutrients, to chemicals, to different things and drugs to protect the brain, the nerves, and the eyes. Well, what happens, for example, do you remember if you take Benadryl or your regular antihistamines, how groggy you can get? Well, the reason that happens is those drugs cross the blood-brain barrier and affect brain and your function, your alertness. Well, that's why when you see drugs like Claritin or some of these that are non-sedating antihistamines, the reason that happens is those drugs do not cross the blood-brain barrier. I hope that makes it a little easier to understand, but this is important because not only is grapeseed extract very potent, but it crosses into this very difficult area around the brain, eyes, and nerves. So it protects against oxidative stress. And diseases like Alzheimer's, dementia, Parkinson's disease, macular degeneration. You look at cataracts, and especially neurodegenerative diseases like MS, even Lynch disease. Some of these really tough neurodegenerative diseases. Grapeseed extract is key in protecting. And by the time we diagnose someone with Alzheimer's, dementia, or Parkinson's disease, 80% of those brain cells involved in these diseases have already been destroyed. That's why you don't see much improvement in anybody with Alzheimer's, dementia, very little improvement in Parkinson's disease. Yes, we might help these patients for 3 or 4 years with our medication, but then they go on downhill. Just look at Muhammad Ali or Michael J. Fox. You know, you start to see this and you start to realize that this is a problem. But I have had wonderful results in my patients who already may have macular degeneration or MS or Parkinson's, even cataracts. It is not a treatment for the disease, but I will tell you, it is a wonderful nutrient that I recommend in those patients because it helps them at least try to take back control of their health. Now, the other thing I mentioned, a very neat characteristic of grapeseed extract, is the fact that it's a potent anti-inflammatory. Now, most of us realize we just have too much inflammation in our bodies. A lot of the foods we eat, our stressful lifestyles, just everything that we do, the coffee we drink, a lot of things that we do increases inflammation. Even the oxidative stress increases inflammation. But what grapeseed has been shown to be is a natural, what we call COX-2 anti-inflammatory. It's natural, but it functions and acts like a drug like Celebrex without all the side effects. So I've seen my patients who have increased inflammation that it is key in helping them try to take back control of their health. In my patients with asthma, we know now asthma is primarily inflammatory disease of the lungs. I have amazing improvement in some of my asthma patients. I also see a lot of my asthma, hay fever patients have allergies. Remember I talked to you that this is an anti-allergen. People with arthritis, and I don't care if it's rheumatoid or psoriatic arthritis or just degenerative arthritis, grapeseed extract is wonderful. But one of the areas where we see a lot of inflammation are two diseases that occur in our bowels, ulcerative colitis and Crohn's disease. Now, these are autoimmune diseases, but when they study the bowel, they show that the bowel is significantly depleted in antioxidants. So when you take grapeseed extract, you can help rebuild your antioxidant defense system, but at the same time, you decrease inflammation. So you have to understand that it really is a wonderful anti-inflammatory. And as I mentioned, it is a potent anti-allergen. You know, and it's natural. It just is a characteristic of grapeseed extract. And what we find is that diseases like asthma or hay fever, there's an allergy component. There's an inflammatory component. And so grapeseed extract is an ideal supplement for these individuals. A lot of us are suffering from food allergies. I remember working with a child who had seemed to be allergic to every food. I think he tested for over 80 foods and he was positive. Well, after 6 months of my nutritional recommendations, he only had 2 food allergies. And there's some you'll never get rid of, but it's something to think about because I find allergies are the first sign of a depleted immune system. We've been run down. And I know that, for example, when my children were going to grade school, the physical ed teacher said she would have them run a half mile during PE. She said, if I did that 10 years ago, it was no problem, but today it seems like I end up with 2 pocketfuls of inhalers because everybody has to shoot up with their bronchodilator, their Proventil or albuterol, before they can run. We're seeing so much in the way of exertional asthma and all these. I don't think I've had any patient who has not seen some improvement in their asthma and hay fever with taking appropriate doses of grapeseed extract. Now, another aspect that a lot of people don't think about is skin allergies. We call it chronic hives or chronic urticaria. And some people just seem to be really sensitive. They have a lot of problems. And so this is another area where grapeseed extract and its anti-allergen ability is wonderful. Now, I told you that one of the unique properties of grapeseed extract is it penetrates all the tissues of the body. But one of the areas it really is effective is in skin. And we have seen that when I did my research on this several years ago on grapeseed extract, I found it interesting in Europe. They actually use grapeseed extract to treat eczema and psoriasis. And I've had wonderful success in my young children that suffer with moderate to severe eczema just by using fish oil, and grapeseed extract. You know, a lot of people try to put creams and lotions and all that. And when I started to treat this internally by just giving the body the omega-3 fats that it wants and using grapeseed extract, I had great success. And I have had very good success in helping individuals who have mild to moderate psoriasis. Now, when you have severe psoriasis, I have not seen much improvement. But any of this, we are not using this as alternative treatment. I never take anybody off the medication they're taking or have been prescribed. Now, if they have a positive response and they improve enough, their doctor might take them off their medication, but that's between them and their personal physician. All I'm trying to do is build up the body's natural defenses. As I told you, even though I've talked about a lot of diseases here, I believe that along with a healthy diet, a modest exercise program, that nutritional supplementation is a key lifestyle. This is something people should be doing their entire life. This is just a way of life. That gives you the absolute best chance of maintaining your health, or if you've lost it, even a chance of taking back control of your health. And that's what's key. So I just want to end this part of the talk on grapeseed extract and diabetes. One thing I have learned, everything I've shared with you, is that I strongly recommend grapeseed extract to all my diabetic patients. It's just something I've done for years, and I even am more aggressive about it now because 80% of my diabetics, or anybody's diabetics, die prematurely from what is referred to as a cardiovascular event, like a heart attack or stroke. This was true in 1970, and it's true today. All the treatments, all the medicine we have, all the visits, everything that we're trying to do to control diabetes, we have not changed this horrible statistic. And that's why I'm so excited about what we're doing in regards to weight loss, the Healthy for Life program, and the lifestyle changes that we're promoting at RX, is the fact that we're now learning that we need to be treating prediabetes as aggressively as we do diabetes. But what is very important is the fact that, as I shared with you, the treatment, the recommended treatment by our diabetes specialist, the endocrinologist, says it should be intensive lifestyle changes. Well, I personally believe one of the key lifestyle changes, along with a healthy diet and exercise, should be nutritional supplementation. And I always recommend not only my cellular nutrition, or in that case the optimals, but I add additional grapeseed extract to this. Remember, I shared with you in the first slide that the grapeseed extract improves insulin sensitivity. But here's the key thing. The small vessels in diabetics tend to weaken. In the eyes, you get hemorrhages in the eyes. That's why ophthalmologists are always checking their diabetic patients, because they want to see if there's hemorrhage in the back of their eyes. The nerve damage, neuropathy, kidney problems, all of this is related to small vessel disease, and grapeseed extract has this unique ability to incorporate itself into the elastic fibers of those smallest arteries and strengthen them. Grapeseed, you know, that's what's very important, plus all of the things I've shared with you in regards to cardiovascular health. Now, I want to just share with you why I am so excited about Vinali. I believe, and I'm not alone in this, that it's the absolute best grapeseed extract available in the world today. RX has a unique grapeseed, and they're actually one of the only ones. I just visited with with Brent Roth, who's our biochemist, that's our manufacturer for the RX products. He says no one gets their grapeseed from Indina except us. And Indina is located in Italy, and what makes them unique, they're a family-owned business, and they have grown a generation after generation of the most potent Chardonnay grape, where we get the most potent grapeseed extract. Now, there are over 200 suppliers of grapeseed extract. So when I talk about grapeseed extract, and I do it in generic fashion, The thing that's really disturbing to me is a lot of people run out and get grapeseed, and it's not that potent. It is not that pure. And one of the key things before I joined RX is I had to know where they got their grapeseed extract. And when I found out that it came from Andina, I was impressed because I know it costs twice as much as the next best grapeseed extract. Andina actually tests for over 350 different toxins and pollutants before they send it to RX. Now, they're only required to test for 34, and the next best company that gives raw grapeseed extract only tests for about 50. So that in itself shows you the quality of grapeseed and the quality of products that RX is committed to. And this is something you have to understand. We are going to see wonderful health results because we have such potent grapeseed. And anybody who's taking the optimals, the neat thing is you're already getting 100 milligrams of this very potent grapeseed extract in your optimals. And we can add Vinali for anybody who may be concerned about the other things that I've mentioned. So I think that's a critical thing to understand. So I want you to understand my approach to nutritional medicine because I'm really different than almost everybody else out there. You see, nutritional medicine has been practiced in the last half century to try to determine what you're a little deficient in or what you need more of. And so they do hair samples, blood samples, iridology. They do muscle testing, urine samples, muscle testing, everything to try to figure out what you need a little more of or a little less of. But you see, the problem is not a nutritional deficiency. The problem is oxidative stress. So even though we do all of our clinical trials in the medical literature trying to find out the magic bullet, or we look at vitamin E in one study, or then magnesium in another, or selenium in another, or beta-carotene in another, you know, vitamin E is not a drug. It's simply a nutrient we get in our food. But because of supplementation, now we can get it at levels you can't obtain from your food. So I know that when I look at the medical literature and I see that 90% of the studies, even done with a single nutrient, when it's given in their optimal or advanced levels, that there's a health benefit. What I want is I want my patients to get all the health benefits of all these nutrients. So that is why I am so excited about RX, because they've put all of these essential nutrients in their optimals at these optimal levels, or these advanced levels that have been shown to provide a health benefit in our medical literature. They are not RDA levels. We all realize now RDA levels aren't enough to create a health benefit. In fact, there's study after study that shows that taking a one-a-day vitamin, there's really not a health benefit. But to provide cellular nutrition, I recommend that all my patients take the optimals. And so this is what my pyramid looks like. And one of the enhancers that I talk about, and I talked about tonight, is grapeseed extract in the form of Vinali. So I want all my patients to be taking the optimals, because if you take grapeseed by itself, it is not nearly as potent as you take it with all these other nutrients because of synergy. In other words, they all work together in different parts of the body against different free radicals, and this is why they're a team. And you have to put them together. They become like a superfood. That's why I'm so excited with the optimals, as I shared in the last webinar, that they have whole food concentrates. You know, we have super plant foods and we have super juice concentrate, where we put all this together because there's a lot of nutrients in foods that we haven't really been able to identify, but we know they're there. And so people should consider adding Vinali as an enhancer to their optimals. So remember, the problem is oxidative stress. It is not a nutritional deficiency. And once you understand that, then if you take the optimals and you're taking all these essential nutrients, this is what I've learned in my medical practice, you're going to bring all of those deficiencies up within 6 months. But you're also going to bring all the supporting nutrients, the B vitamins, the so-called antioxidant minerals, which all of these antioxidants need to do their job effectively, up to their optimal levels. And that's why I never have anybody start a nutritional supplement program unless they're going to commit a minimum of 6 months. It's just in all my recommendations. It's what I've learned over the past 18 years, because balance is the key. You want to have more antioxidants and their supporting nutrients available than the number of free radicals you produce. So this is the focus and goal of nutritional medicine. That's what I believe. So when I recommend nutritional supplements and it's about health, my goal, I'm not treating any disease. I'm just bringing oxidative stress back under control. And my patients who come in who have excellent health, they have no illnesses, you know, the optimals may be just fine. If they don't get enough essential fats in because we can't make those, then I might recommend something like Omega Q with it. You know, there's other times you need a little additional magnesium and calcium, and I know that RX will be bringing that product out in the very near future. So what happens is we're going to be seeing that this is what we have. But if I have a patient comes in who's got rheumatoid arthritis or MS or heart disease or cancer or Crohn's disease, I know, and the medical literature shows me and proves to me, that they have much more in the way of oxidative stress than someone who has excellent health. So I add these potent enhancers to their regime. And of course, the most potent one, in my mind, and what the medical literature shows, is grape seed extract. So that's why RX is putting together a whole set of nutritional supplements. This is one aspect of RX as an opportunity company, but they are not stopping at anything except to provide you the absolute best nutritional supplements in the marketplace today. They're taking nutritional medicine to the next level. I'm already seeing it in my practice. I just cannot believe the results and the health benefits my patients are now receiving now that I have them on RX. It is wonderful. It's why I joined the company, because I knew RX was going to take nutritional medicine to the next level. Now, next webinar, the first Thursday in March, I'm going to be talking about BioPro Q, and so I'll be going through a very similar talk with this, and that'll be the 7th of March, and so it'll be 7 p.m. So share this with your friends or whatever you would like. And if you want to learn more and want more information, look at the the references, the medical references. Consider picking up a book that I wrote called What Your Doctor Doesn't Know About Nutritional Medicine. I share in here many, many health stories that are true, documented, that I've seen in my medical practice. And it's a wonderful book. It just gives you some encouragement. Others may want to consider joining my website at healthconceptsint.com, and if you go / or /RX, you can get a 30% discount on any of the programs that I have, including my Healthy for Life program. So what I'd like to do now is to go ahead and just see if anybody has any questions, and I see there's some that have come in. So I'll try to go through this and see if I can open this up better. As far as the grapeseed, the first question I have here is how much grapeseed extract was taken to produce the results you showed us, like apoptosis by 33%. Really amazingly, it wasn't that much. It was only like 50 milligrams of grapeseed extract. It was really amazing to me. I recommend much more, and I've seen results, and that's kind of what I've learned over the years. Is I've learned how to actually look at the different levels and what people need, and this is kind of what I've learned. You don't write them in textbooks or anything like that as far as that goes. Now I have another one who actually maybe a comment. She is noticing that her acid reflux is no longer bothering her, and she does not have to take her meds since starting Vinali. And if you guys go to one of my medical minutes I would really encourage anybody that has reflux, because I've already written on that. There was a study that came out last fall where people, they did what they call avoidance therapy. They just, in their diet, they avoided soy, dairy, uh, gluten, which is in wheat and your grain products, eggs, peanuts, and shellfish. 80% of those patients who suffered with reflux were able to get off their medications. Now, I believe I've seen this. I've seen it with other nutrients, and I see people who especially start to eat a low glycemic diet, start to exercise, and take nutritional supplements, that their reflux does improve. And so that's a really great comment. Another question, would Vinali work on dogs? Mine has skin allergies. Absolutely. In fact, I am such a proponent of grapeseed extract. Our horses even take grapeseed. Now that takes a lot of grapeseed. But my wife, she's a horse trainer. But if you want to know how much I use in children and in dogs, would be 1 to 2 milligrams of grapeseed extract per pound per day. If you want to write that down, 1 to 2 milligrams per pound per day. Now that works in children. You can break up, the nice thing about Vinali is that it's in a capsule, and so you can vary the amount. And so yes, animals, in fact, the next question was, what's a dose in children? And it'd be the same. It's the same in children, 1 to 2 milligrams per pound. How much, I got a question here, how much do we need to take a day of the grapeseed extract? I think it depends. If you're in good health, I'm comfortable with the optimals. I really believe that. Now, most people are adding either Omega Q or Rejuvenix, or they're adding Vinali to it. Maybe they'll even add some BioPro Q. But that is fine. Now, what I have learned is there are different levels depending. If you have a neurodegenerative disease, it takes more than that. If you have macular degeneration, it takes more. And I have, on my website, I list actually my specific recommendations for over 100 different diseases. So I've spelled that all out, and in fact, that's something that you may want to check out. And I got a question. Do I recommend taking BioPro Q in addition to Omega Q? Again, if you don't have any health problems and you're just doing it, maybe you got some heart disease in your family, or you're just there, I think Omega Q is fine. Of course, you'll hear my excitement about BioPro Q next webinar, because I use it for so many other situations. And I'll explain why. But it just depends. If you are dealing with cancer, if you have any other problems as far as that's concerned, then that is what you need to really look at. And again, I share my specific amounts with different diseases, so it really depends on the individual. The next question is they're concerned about a tremor that they have in their hands. Now, one thing, most doctors will recommend what we call beta blockers, like Inderal, for tremors. They're kind of an intention tremor. And I'll be honest with you, it is very hard. I've not had super success with intention tremors nutritionally, but my recommendations are the grapeseed extract, and I would get up, in that 300 milligrams per day level, just to see if you have a benefit. One other thing you may want to consider is adding a little higher dose magnesium. Magnesium has been shown in the medical literature to decrease, like, for example, seizures by 50%. Now, it doesn't replace medication, but it may allow you to respond better to your medication. And I recommend 400 to 800 milligrams of magnesium citrate. And when we have our calcium magnesium product that comes out. We'll be recommending that, but RX does not have everything. It's a new young company, but they're working on it, and they're going to, like every other product they've come out, it's going to be the best. And so we'll be using it. Just remember, magnesium causes diarrhea, calcium causes constipation, so you kind of have to take some calcium along with that. And so that is fine. So I want, another question is, was this seminar and webinar recorded? Yes, it was, and RX will have it tomorrow. Now, I'm not going to be recording the question answer period. This is our time together. So those people who join the webinar are going to have the privilege, so to speak, to ask questions. Come on, I'll try to do my best to answer them all, and the ones that I can. And I want people to realize I'm not I'm not asking treatment for disease. Now, I had someone who asked about gallbladder pain. One thing that I want to share about gallbladder disease, we always look for gallstones, and as a physician, we looked at it. The problem that we found is the fact that the gallstones are only an indication of a gallbladder disease. The disease is in the wall of the gallbladder, and it produces gallstones. Years ago, there's a drug that actually came out where we could shrink up or dissolve the gallstones. The trouble that we had is we made the gallstones smaller so they could pass down, and then they would block the common duct in the liver, and we created more problems than we helped. I'm afraid there is nothing nutritionally that really helps gallbladder disease. And so if you truly have gallbladder disease, it's a surgical disease. And obviously, you may want to have this taken care of when you're not having a gallbladder attack. They can do that now through a laparoscope. And so that's something that you may want to consider. Now, someone asks, is there some advantage of taking Vinali more than 2 per day? Absolutely. I have found, for example, I'll just go through this a little bit. Macular degeneration. It is the key nutrient. I've had so many patients who've had documented visual improvement by their physician, by their ophthalmologist, when I get over 300 milligrams of grape seed a day. Now, I'm not curing macular degeneration, but there's improvement. We know that lutein, zeaxanthin, the carotenoids are important, but they're in your optimals. But the key nutrient is grapeseed. Now, in dealing with my MS patients, I learned this years ago. I had to get over 400 milligrams of grapeseed extract. But now if I'm dealing with rheumatoid arthritis or Crohn's disease or any of these, adding 200 milligrams of grapeseed to your optimals is fine. So they're all different kinds of levels. If you have asthma and allergies, if it's in season, I sometimes get my asthma patients to be, if they have trouble in the spring or fall, they might increase to 3 or 4 a day. And then when they're not having any problems, they might only be taking 1 a day. Now, I always tell my mothers who come in with their children who have asthma problems, I say, now look, if we start in the spring, they're going to be better in the fall. If we start in the fall, they may not get better till the spring. They got to give me 6 months. But I have rarely seen anybody not have some improvement. And sometimes it's dramatic. So it's pretty exciting to be able to do this. Now, there is a question, can you get too much grapeseed extract? Can you get too much? Absolutely not. I use up to 800 milligrams of grapeseed in my Lou Gehrig's patients, ALS. That's a very difficult disease. I've not seen many respond. I've seen some respond. But when I studied the medical literature, grapeseed extract, CoQ10, there is no danger in taking too much. Now, the biggest problem, it costs a lot of money. So you don't want to be taking any more than you need. And a lot of people will take a larger dose, to get control, and then they back off to what I call a maintenance level. So they're taking the least amount. Diabetic children, I would have every diabetic child on grapeseed extract. It is one of the key things. I've actually seen adult type 1 diabetics come in, they're dealing with diabetic retinopathy, and I've seen them respond or have health improvements with that on good doses of grapeseed extract. And here's another individual who's giving a report. They've been on, they stated here, they've been taking the Optimals, Omega, and Vinali, and Omega Q, and they're no longer on the reflux medicine. They're off Celebrex, but you know, and they're not taking the Lipitor. This is what the reason I'm excited about those kind of testimonials is the fact the reason they came off their medication wasn't that this is alternative treatment. Don't ever hear me say you take this instead of your statin drug or you take this instead of your arthritis medication. But if your health improves enough that you go in and you're not having any trouble, your cholesterol drops enough, and asthma is a perfect example. You know, all my patients, after they've been on 6-7 months, they'll come in and say, jeepers, I'm just not using my inhalers as much because I'm not having these attacks. And so what happens is that you say, oh my goodness, they've had a health improvement. That's wonderful. You know, I still prescribe medication, but I try to use medication as a last resort, not a first choice. But if patients come in and they're on a lot of medication, I don't take them off. I try to get them to eat a healthy diet. I get them to lose weight. I get them to start exercising and taking high quality nutritional supplements. And obviously, you know, in my practice, I recommend RX because I feel they're the best. But the thing is, over time, there's many opportunities to be able to decrease maybe the amount they're taking, or in some cases, be able to eliminate medication. Now, what happens in asthma, and I got a question here, how does it improve in asthma, grapeseed, and I just want to review that. It does it by two things. See, asthma is inflammation in your lungs, which causes what we call bronchospasm. Years ago, when I started in medicine in the 70s, we thought it was all bronchospasm. So when we would get someone in with an acute asthmatic attack, we would give them bronchodilators. And that's the way we treated it. But in the early 80s, they began to realize the primary cause was inflammation in the lung. That set off the bronchospasm. So that's why asthmatics go in and they get their burst of steroids, or they take an inhaler that have steroids in them, because steroids are the best anti-inflammatory you can get. But also, grapeseed extract is an anti-allergen. We react to things around. That's why people walk into around cats or dogs or animals or different things and they get an asthmatic attack because they have allergens. Well, what you'll find is over time, yes, you don't ever get rid of it. I don't cure anything, but you don't have as bad a result. So it's those two reasons that grapeseed really helps asthma. Can cats take grapeseed? Absolutely. 1 to 2 milligrams per pound per day. And I have a question. Is my daughter she's taking the Optimals and other RX products, is she overdoing it? It depends on her size, her weight. Now, if I have, and I'll go over this, and I'm going to, it's on my website, the children's doses, but I'll quickly kind of go over this. The nice thing about the Optimals is the fact that they're in capsules, and we can do that. You know, eventually they're going to come out with children's products. New companies always do this, but what I do in my practice is if I have a child between the ages of 2 and 5 years old, I recommend 1 antioxidant capsule and 1 mineral capsule. When they get about 7, 8 years old, in that area, or about 60, 70 pounds, I'll use 2 antioxidant capsules and 1 mineral. When they get between 8 and 10, I'll increase to 2 minerals. I know this might be too quick for everybody, but once they get over 100 pounds, 110 pounds, I'm doing about 2/3 dose, like 4 antioxidant capsules and 3 minerals. And when they get over 120 pounds, then I'm using the adult doses. So if your daughter is over 120 pounds, you're not overdoing it. And there's no danger here. In fact, in my book, Bionutrition, that's a book that a lot of people don't know. It's one of the first books that I wrote back in 1996. and researching, I actually updated that here a couple years ago, and I have 2 chapters on the safety of nutritional supplements. And everything that is in the RX products is in a very, very safe range. There is no danger. And I'm fighting this. I'm fighting City Hall, the medical community, because they come out, oh, don't take vitamin E, it causes heart disease, or causes prostate cancer, does this. Well, I have 2 chapters in that book where I detail why we see negative studies. And I've written on it. There's a lot on my website. I've tried to address some of the key ones in my medical minutes. And I want to, there's some questions I'm not going to be totally answering. I just don't know the answer. We may have to talk to RX about some of them, just about the Slender X. I'm not quite sure that, but I know there's no toxic things in there. I'm just not sure, so I can't answer that. I have had someone ask about ALS patients. Let me share with you. ALS is probably one of the toughest diseases to deal with. It's horrible. I've had friends die. I've worked with many of my patients with ALS. I have to say I've had a handful of ALS patients that I've gotten a response. I had a gentleman in Philadelphia that really had significant improvement. I had another gentleman in Florida that I consulted who probably didn't decline for 3 or 4 years. But most of my ALS patients, I don't see much help. They tend to go downhill, but you never know. And the earlier you catch it, the better. I've always been very interested, in some of the ALS patients. One of the causes, now it's not in everyone, but there's a natural antioxidant that we make called SOD, superoxide dismutase. And I'm not trying to be fancy, but it's one of the antioxidant systems that is deficient in a lot of these people who develop ALS. So I've always felt that by improving and trying to support the antioxidant defense system, it makes sense because we know it's oxidative stress that causes it. But it is a very difficult disease, much like Alzheimer's dementia. It's as far as that goes. Now I have a question about a twitching eye. You know how your eye starts to twitch? I would get some magnesium citrate. Magnesium is nature's own calcium channel blocker, but when you get night cramps or you get restless leg syndrome or you get tight muscles, my fibromyalgia patients get tight myofascial bands, but twitching muscles and all that is usually a sign of a magnesium deficiency. Now I don't normally, there is some magnesium in the optimals and all that, but I would try to find whatever her age is a little, give an additional 200 or 300 milligrams as far as these are concerned, trying to help her. And I find that over time that will help. Someone asked, where are the webinars located? I'm not, I know it's in the seminars, webinars, it's in the educational part. There's the television part, and I know there's a lot of that, but I think that's where they're posting it. But maybe someone should write RX and have them put out a notice to where they can find these webinars, because all of my webinars and most of them, we're going to try to record them, put them up, because a lot of people can't make it at this time, and we want them available 24/7. I got a question here: is traumatic brain injury helped by grape seed extract? And I feel absolutely. There are studies with neck injuries, brain injuries, that the damage is caused by oxidative stress. In fact, I work closely with a neurologist and a neurosurgeon here in my hometown, where they were cooling down the spinal cord with spinal cord injuries because that reduced oxidative stress and damage. And I have dealt with people who have had traumatic brain injuries, and we've literally got them on higher dose grapeseed extract, and in that case I always get over 400 milligrams total. That is just what I've learned with any neural or brain damage as far as that goes. Now, that's just something I have seen, And the body's going to heal. Do we have any studies that show that it improves it? Absolutely not. I just know that it's oxidative stress. Um, and so as far as that goes. Now, when someone has a constant pain in the neck and back, um, I think you've got to find out the cause. Is it muscle contraction type headaches? Do you have TMJ syndrome? You got to get to the root cause. You know, it's hard to know because headaches are not a disease. Neck pain is not a disease. They're symptoms. You know, the headache can be migraine, it can be vascular, it can be muscle contraction, all of that. So I think you need to find out more. Maybe, you know, check with your personal physician to figure out, you know, as far as this goes. Now, someone asked about glaucoma. I have to share, there aren't as many studies on glaucoma and nutritional supplementation. But my personal experience is a lot of the people, my patients that I've treated, who have macular degeneration or cataracts also suffer from glaucoma. And I have seen improvement in eye pressure, which I personally relate. Now, those are anecdotal. I have no studies to back that up. It's just my own, but you know, there's no harm in trying. It's safe, and usually they're having their eye pressure checked, and they're on medication, obviously, or drops for their glaucoma. So anyway, you know, if I don't know. Someone's asking about colitis and macular disease or both. Though, you know, when you start adding diseases together as a general principle, you know, when I give nutritional supplement recommendations, I'm not really treating a disease. All I'm doing is trying to bring oxidative stress back under control. And so all I do is vary the amount that people have. And so if they have a lot of health problems or on more medication, for example, if they're undergoing chemotherapy, I tend to push the treatment. So these are something that you need to find out. Someone asked about varicose veins and blood vessels. Yes, there are studies. Grape seed extract does help varicose veins. The problem with varicose veins is the fact there's a mechanical component to it. See, as blood comes back to the heart in the veins of the leg, where most of your varicose veins are, there are valves that hold it from backflowing. So it comes up to a certain level, and then there's a valve that blocks it from going back. Well, in varicosities or varicose veins, those valves break, and so there's increased pressure, and then it dilates the vein. So when you have really bad varicose veins, it really doesn't help. I have had some people say their varicose veins have improved, but this is something that you have to look at. Now, someone asked about a liver angioma. A liver angioma is a benign tumor of the liver. It's more of an incidental finding. It's a group of blood vessels that form a tumor. People like this, or like you if you have this, are normal. Don't worry about it. It's just something your doctor notes. We pick it up. We just want to make sure it's not a cancer. And once we've ruled that out, you can take Slenderex or any of the nutritional products. Now, someone asked, would the amount of Vinali for diabetic children be 1 to 2 milligrams per pound per day? Yes, that's what I've used. And you know, I would tend to go more towards a 2 milligrams per pound if a child were diabetic. You know, this is something that I find starting early on is very critical, because it's much easier to protect their health as far as goes. Someone just told me, Rick told me, that it's rxchannel.com is where these webinars are. So thank you, Rick. People need to know that. I should know that. Now I do. I appreciate that. So that's wonderful. And I do have some webinars on YouTube under my name. I know some of the medical minutes have been put up there. We're sharing it. We're trying to get these out just to help spread the message of health, and obviously wonderful the wonderful products that we now have available to us. And that's something that's there. And I'm glad I'm getting some really wonderful comments back on these on the webinar in regards to thank yous and all of that. You know, we're looking at, there's so many questions and we're coming up to our time here, but I want you to know this is where my heart is. I'm here to help you, help your family, you yourself personally, your loved ones, people, to know the power of nutritional medicine. My approach, I've helped many, I've had wonderful results, we have wonderful testimonials are coming out. I just went out to Salt Lake City last week just to share with RX what I'm seeing in my practice. I am seeing better results using RX products than anything I've ever used before in my practice. It's another tool in my toolbox. And I look forward to doing these. I'm sorry I couldn't get to everyone. I tried, but I'll be back and I'll keep answering questions. At the end, I hope, let me know if this is good, if you like the question answer periods. It's something, and share. I mean, I'll try to make them more general so everybody learns from them. But again, thank you for being with us, and I look forward to being with you again March 7th, and I'm going to talk about CoQ10, ubiquinol, and BioPro-Q, so you just learn more about that. Thank you.